and it falls to me simply to introduce Josh Gordon, the Director of the National Institute of Mental Health at NIH, to introduce the subject and his colleagues. Josh, thank you.
Thank you, everyone, for coming, and thank you for the organizers of the meeting for inviting us to participate. Panel 1 is entitled Brain Plasticity and Its Disorders, Autism Spectrum, and Schizophrenias. And in the context of a meeting on neurodevelopment, autism and schizophrenia can be thought of as the quintessential neurodevelopmental disorders. With me here today, I feel like there should be like a fireplace on the side or something. Or opulent. With me, we don't have them in government like this, is Matt State, the Oberndorf Family Distinguished Professor in Psychiatry, Chair of the Department of Psychiatry, and Director of the Langley Porter Psychiatric Institute at UCSF. Those of you who've been to Langley Porter will say that's not so much, but he's building a new one, which should be as opulent as these chairs. Next is Charles Nelson, who's Professor of Pediatrics and Neuroscience at Harvard Medical School, Professor of Education at Harvard University, and the Richard David Scott Chair in Pediatric Developmental Medicine Research at Boston Children's. To Chuck's left is Beth Stevens, Associate Professor of Neurology in the F.M. Kirby Neurobiology Program at Boston Children's Hospital and Harvard Medical School, and apparently a genius. Because Beth, of course, was recipient of, I should explain that, of the MacArthur Fellowship Award in 2015. And to Beth's left is Diana Barch, Professor of Psychological Brain Sciences and Couch Professor of Psychiatry at Washington University in St. Louis, who lives in a dorm. It's true. So what are we here to talk about? We're here to talk about, as I said before, schizophrenia and autism and the role of brain plasticity in these two disorders. Just so that everyone's on the same page, although you all probably know as much, if not more, about it than I do, autism is a disorder manifest early in childhood, which has three principal areas of disability: disability in social function, restricted interests, and repetitive behaviors. Autism is really not a single disorder, not that any psychiatric disorder is, but autism, more than even others, is a spectrum of function that goes, so individuals with an autism diagnosis can be profoundly disabled, with lacking even the ability for verbal communication, and or individuals can be quite highly functioning with normal or even supernormal IQs and able to function well. And one sees this when one talks with individuals with autism who are self-advocates, who are functioning well in the world, and parents of children or even adults with autism who are so profoundly disabled that they need ongoing 24-hour care. So the spectrum of autism is tremendous, and it contributes to the difficulty of trying to understand it. Schizophrenia is perhaps, I would say, less heterogeneous, but we all know that schizophrenia is tremendously heterogeneous nonetheless. And I think schizophrenia, whose onset is more typically in late adolescence or early adulthood than early childhood, was not necessarily initially thought of as a neurodevelopmental disorder, but over the last 30 to 40 years, it's really been appreciated that not only the origins in terms of etiology, but also the origins in terms of symptomatology arise during early development, and the symptoms certainly manifest in early to mid-adolescence. And we're going to hear some about that today from the various speakers. Gil encouraged the use of a clinical vignette, so I thought I'd share a short bit about a patient of mine that I saw for about 15 years while I was still practicing in New York. Just to give you a sense of the profound disability someone with schizophrenia endures. So this patient was an adult, middle-aged when I first saw her, and she had a history of schizophrenia that dated back into her late adolescent period, which is classical. Early on, she had been hospitalized many times, and eventually she was found to respond to Clozaril, which is, or clozapine is the generic form, which was the first antipsychotic that really worked for those who didn't respond to other antipsychotics. As is often the case in individuals with schizophrenia, the hallucinations and delusions which characterize the most prominent symptoms of the illness responded well to the medication, but the cognitive and social symptoms did not. And so for much of her adult life, she was isolated and poorly functional. And just one profound example of that, when she first came to see me, my office was about 4 blocks away from her apartment in New York. And she had to take a prearranged car service that her parents had arranged for her to get her those 4 blocks to my apartment, not because of fear, although many individuals with schizophrenia do suffer from anxiety, but because she was unable to navigate those 4 blocks on her own. It took her about 4 years before she was able to make the walk by herself. So there are some profound cognitive deficits in specific areas. However, there's also profound functional reserve in these individuals. So the same person that I mentioned, by the time I met her, was engaged through a clubhouse mechanism in New York with other individuals with schizophrenia and other serious mental illnesses. Eventually met one particular person there, married him, and has now been happily married for 7 years. And she and her husband, who also has schizophrenia, are fortunate enough to be able to travel all over the world by themselves and enjoy a life with some help and significant planning that is at least socially full. So I think you can get a sense of the profound disability, but also the profound hope that if we can understand and treat these illnesses better, we can do much better for them. So with that context, I want to then turn to the panelists. We're going to hear today about the genes which predispose to these illnesses, the interactions of those genes with the environment. We're going to hear about biological mechanisms, and we're going to hear about the time course of these illnesses as they occur through development. I think I don't need to point out to this audience the real parallels between what we're going to hear about today and what we already heard about from Corey in terms of the genes and their interaction with the environment and how they guide behavior are manifest, and then of course the discussion in particular about how developmental time courses can be disturbed by alterations in these genes. We can easily understand how things in the worm are indeed relevant to the human.